Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's beautiful outside. Just enjoy that day. Get out for a walk. Do the things that you need to do for your health. But first, listen here, okay? If you go outside, get in the car, turn the radio on. If you go outside, take your smartphone, listen to me online, but make sure you listen because we got a lot of information for you. We're here at 888-630-9625, 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, well, here's your opportunity. You've probably done everything you can and it didn't work, so let's put it out without drugs, without surgery, show you what you can do naturally without the influence of things that are destructive to your body. Let's show you what is supportive to your body. 888-630-9625. Special program for you today. It's actually a continuum of something that we've been presenting over the last several months or so. And we want to kind of entice you, bring you in, and get you to attend this Wednesday evening's presentation, the 16th, at the Roselle Center for Healing in Fairfax. Your presenter, my guest in studio, Dr. Stephanie Pina. She's going to be talking about, well, we can call it herbs 3 or 4 or whatever it is, but it's a continuation of all that stuff that's out there that's not medications been synthesized by the drug companies, but you actually can use to make a difference. Dr. Pina, hi.
Hi.
It's a beautiful day.
It is.
It's absolutely, I almost wish we could have sat outside and done this, watching people walk by the studio.
Be amongst a botanical garden or something and just be like, okay, which herb am I looking at right now?
That's right. That's right. So, on the way to the studio and 2 days ago in the office and a couple days before that, I said, so what are we talking about Sunday? And you said herbs. I said, great. What does that mean? And so I asked you again on the way to the studio today, Dr. Pina, what are we talking about? Herbs. So that gives me...
That doesn't say enough.
Well,
I think that says enough.
What it does, see, you got to be careful what you tell me because that opens up the door to a lot of different things. So we're going to talk about herbal medicine, and you're going to talk about that Wednesday night. And any of you have heard Dr. Pina, she's brilliant. She has tremendous capacity. She is our resident doctor of naturopathic medicine in the office. And so this is her deal. She understands it. And so herbal medicine, it's many names. You can talk about botanical medicine. You can talk about herbalism. You can talk about a medical system based on plants and so forth and so on. But the truth of it is, it's what God grew out there for you to get better with. And so let's talk about that. Let's start to begin with. Why herbs and not medicine?
Well, I think you can't actually separate the two of them together. I think they go hand in hand. Whether you look at it as, either God or Mother Nature put everything on the planet for a reason, and, the herbs are part of it, and we can use them medicinally or, as with our cooking or just even to look at the beauty of it. Each herb or each plant can have multiple purposes. And so I think when we start to use them as medicines, you kind of look at a couple approaches to it. You look at more of a traditional approach to it where, you had to base things on observation. You didn't have all the scientific knowledge that we have now. So you based on what worked and what didn't work. And if it didn't work, you didn't get great results and you moved on to the next one, or you observed, the way plants and animals interact with it. And then you started to use plants more in more of a modern day type of nature and science, and you start figuring out which are the active components and ingredients in those herbs, how do you make current medications out of it, and how do you kind of put things together so that you can get the right combinations of herbs, plants, minerals, and even, vitamins, and how do you mix everything together properly?
One of the things that I keep trying to tell patients, and they ask me the difference, and the question that we're just starting to cover right now, and I'm going to throw the the ball up to you again on this, is that you can use an herb and you can use the medicinal extract, the medicine, the thing that's been patented by the drug company. And the problem, my problem, and I think is the actual essence of all of this, is simply this. In nature, you have, we'll go to Valeria. And from Valeria came Valium. And Valium is a tranquilizer. Valeria and Valium have similar properties and characteristics relative to their application in a therapeutic platform. The problem is, with Valeria and not with Valium, is the cofactors, the synergistics that are natural to nature, making it less of a problem to the body, doesn't exist in the drug. Subsequently, the drug causes a problem and has tremendous side effects and counterindications. So let's talk about that for a minute, because my belief system is they're totally separate. I mean, they have properties. You know, there was, I'm going to give this to you to run with. There was a movie a while back with Sean Connery, and I think it was Medicine Man. It was in South America and so forth, and they were trying to find this ingredient, this chemical that did whatever. And what they found out ultimately is that once they extracted it from the jungle, that it didn't work anymore. And it was all about the bugs and everything else that was associated with it. Speak to that.
Well, it's always interesting, and it's a dilemma that you see as a kind of catch-22 nowadays, too, because it's easy to kind of find those chemical derivatives. We can do that quite easily in laboratories and pull that out and create different, medications. I mean, a lot of chemotherapy drugs have come off of plant sources, mistletoe being one of them. But there is that missing factor. There's almost like the plant's energetics. There's different parts of the plant when you're using them in botanical medicine that stimulate different parts of the body. You can have someone using a leaf versus a root, and all of a sudden it's a completely different substance. So a lot of the times when you're using herbal medicine, certain areas of the plant are going to be used, but they're still looking at the synergetics of the whole plant. They realize that you need more than just that one constituent, and who knows if it's the other constituents that are with the one that they picked out that actually makes it the most effective.
Well, to go off of what you just said, ginger root, for example, you can't use the ginger plant. You have to use the root itself if you want to do something with nausea. And so many patients, you get a little piece of organic ginger and you just put it in your mouth and you suck on it and so forth. But if you go get ginger tea, which often is a combination of all this stuff, it doesn't work. Mm-hmm. And that's to the point of which you're drawing to. But let's talk about let's get it into present application. It's spring. It's blooming all over the place. And people are sneezing and they're coughing. Their eyes are running. There are black circles around their eyes. They can't breathe. And they're coming with secondary infections as a result of that. So how do you discern, if you will, the difference between a very simple allergic response because there's a lot of pollen in the air and your nose is itching and so forth, and somebody who has a profound autoimmune reaction, and then not so much to get in the type of herbs, a big question. Okay. Mm-hmm. How do you know the application? Do you support immune system or do you fight the symptom?
Well, the one thing about seasonal allergies that I think is funny, especially when it's environmental, because obviously you have to rule out whether someone has a sensitivity and it's more leaky gut, the different types of autoimmunes like you are guessing or mentioned. The main thing is that this is where Mother Nature kind of has a catch-22, because essentially those plants have to pollinate in order to survive, so they're going to do their thing, and we just kind of end up being in the way. And when we actually get exposed to different types of pollens and ragweeds and fungus and molds, the body kind of has a normal response where it says this isn't normal, and it produces mucus and makes us itchy and has watery eyes in order to get that substance out. So the body's doing what it needs to do. The problem becomes when it overreacts and now you can't just get away from it, but now you kind of have a continuous. And that's where you see more underlying issues, because if you can get yourself away from the allergen, even if it means going inside, sometimes like I notice when I'm driving in the morning, I might get a little congested. If I'm inside, it's not going to be as bad. If you can get yourself away from that, the people that have other issues going on, that their immune system is hyperactive, you have to look at other things, what's going on with the foods that they're eating, is there a neurological issue going on, are the ones that can't get their bodies to calm down. They just can't figure out. So you can use as many, medications or herbs or anything, and if you don't treat the overall body, the herbs are going to help out to some extent, but it's never going to treat the whole system. So it's a mixture of a lot of different things.
This time of the year, we start seeing people that have sensitivities to mold and fungus as well. So they have chronic problems with that year long, but because there's such an abundance of it, the ground is starting to erupt and all these spores are coming out and people are noticing skin rashes and they can't handle them. We get back to our old friend, the adrenal system, the fight-flight system, because that's where most of the steroids come from that protect us from, this reaction. Our mucous membranes are the primary line of defense, and we know that to be the IgA response, the first line, the stormtroopers that go in and break things up, if you will. So let's talk about that a little bit. And I know this Wednesday evening, the 16th, 7:30 p.m. at the Roselle Center for Healing, Dr. Stephanie Pina will be your presenter, and she's going to be talking about herbal applications, springtime applications, and other things of that nature. So if you have questions on herbs, how to use them, combinations of herbs, why they work, this is an opportunity to really ask the expert on all of these different questions that you may have, but more importantly, what do you do about the current stuff, the garbage that's out there that you're fatigued, you can't get out of bed in the morning all of a sudden, and it's because your body can't fight the immune response suppression, if you will, from the environment. So let's talk about that. We give a lot of different herbal remedies for certain things at different times of the year, and it's different. Fall remedies are often different than springtime remedies. One of the things that I like to use this time of the year is either directly or in combination quercetin. Mm-hmm. But quercetin is an anti-inflammatory plus other things, and you'd go to the doc and you'd take Zyrtec and all kinds of other, I won't get into the loving expressions that I have for them. But nevertheless, how do people know that this is just a transient situation, or if it's something that how do you know that? How do you know that it's transit or something that has to be fixed a different way? Just go take this herb, call me later on, tell me how you feel, or, we got a problem here, we need to deal with it.
Well, a lot of the times when patients come in, they've done some experimenting on their own because, there's plenty of research and literature out there that, the latest and greatest story that came up on the news, and so they run out and try to, see what works for them. So you do get information from them because you also want to find out how is their body responding versus the other person that comes in and says, I have allergies. Well, what does that comprise of? When a patient comes in, and if they can actually kind of pinpoint, well, this symptom started happening at this time, but then you can start to go, what's growing right now? What's an issue? Versus the person that comes in and says, this has been going on for a while, I'm getting congestion, I can't get rid of this. And you ask them what's going on, they can't figure out, but, oh yeah, by the way, I had my house remodeled. Then you start looking at chronic exposures that are related to their indoor environment instead of the outdoor environment. So what's going on with water damage, different types of environments, so their body's constantly being exposed to stuff over the time too. So you have to really investigate what they've worked with, what they haven't worked with, and then you can really decide, do you use herbal medicine, a single herb? Do you use herbal medicine in combinations? And basically time when you're using combinations, you're looking at treating the immune system, the adrenal system, the respiratory system in a lot of different ways. So that's where you have to start.
One of the things that I note in practice is that when a patient reacts to any kind of environmental stimulus negatively, if you will, an allergic response pattern, it's often primarily digestive. And because the first line of defense, if you will, has to do with the amount of hydrochloric acid that's in the stomach, and also the digestive enzymes in the upper intestinal tract. And if those aren't there, if they're deficient, if they're hypo, meaning not enough of, then you have a problem. And when we come back, I want to touch about that a little bit, but I also want to remind our listeners that this Wednesday evening, you can get all your questions answered, very specifically how to handle this. Those of you who heard Dr. Stephanie before, she's very approachable and she's very, very knowledgeable. All you need to do is call her office at 703-698-7117. That's 703-698-7117. Tell my staff you'd like to be there. There's never a charge for these events. These are in-house continuing education programs. They're provided for you to educate you, to empower you to make a difference in your life by your hand. We're your guide. We're your teacher. That's what the term physician means. It means teacher. So do it, 703-698-7117. It's going to be a beautiful night. Show up. Love to have you. If you'd like a tour of the office, we'll show you that too. We'll be right back after these important messages.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education. Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Indeed, we're in studio. 888-630-9625. Love to talk to you on any subject. My guest today, your host this Wednesday evening, Dr. Stephanie Pina. She's going to be talking about herbs, and if you've been to her other lectures, this is a continuation. Herb 1, 2, 3, 4. I mean, trust me, you're going to learn more, and you're going to sit there and say, I didn't know that. But more importantly, empowering you to do what you need to do. These in-house continuing education programs are a gift to you. It's a gift to our community. We don't require anything from you other than a reservation. You must reserve your seat. Call our office at 703-698-7117. Tell my staff that you'd like to attend. Before we get back in the program, we do have some people waiting, and because I encourage you to call at 888-630-9625, I want to take your calls. Fred, thank you for calling. Fred, hello. Are you there? Anyway, Fred's not with us. But Fred's question was, can you spell the drug that is Valium? It's not the drug. We were talking about the herb, Fred. Herbs, Fred. And the herb is Valeria. So Valeria is simply Valeria. Valeria.
You passed the herbal spelling test today.
I did, thank you. And because you know what, I spell everything phonetically, so it's a challenge.
Yeah.
I could be in real trouble. So, any comments on that at all?
Valerian's been used for a couple of different things. We know of it because of the sedative effect too, but it's been used in a lot of kind of either by itself or in combination for sleeping, to help out with insomnia, along with other herbs like kava, passion flower. There's one active ingredient they think it may help actually regulate the GABA receptors in the brain, so that's what causes that calming effect. So it can be used for mild calming. Valerian is usually used as the root substance, so when you look at it in a tincture form, it's going to be the root itself. The flower is very pretty. You should be able to see it kind of
Fred's
growing all
back.
over. Oh,
Fred's back.
Okay,
Fred,
here we go.
Are you there? Hi, Fred. Fred's not back.
Okay.
Sorry.
So valerian's been around for a long, long time. It does have some components that you still would want to be careful with your dosing. You wouldn't want to go over anything unless you're working with a professional. But essentially what it's doing is this kind of has the ability to calm the body and kind of help out for anxiety. So like I said, insomnia, calming issues is kind of what it's been recommended for. And whenever you're looking at some of the herbs, the German Commission E, which is sometimes you hear about, was this big report that it was originally the group was put together in the 78, And then they published updated reports in 1984, 1994, and they haven't done one since. But it's kind of given the world a really good definition of what's going on with individual herbs. But unfortunately, a lot of herbs weren't added in there. I think there's only 360 herbs added in.
Oh, that's all.
That's it. That's nothing. That's nothing.
It's easy.
But essentially, there are updates on, and there's lots of scientific research that goes on, whether it's an individual component in the herb or the whole herb abstract. Unfortunately, some of it's in German, some of it's not published in the U.S., some of it's in Chinese. Yeah. So you see a lot of this information that could be greatly increased to something like the German Commission, but it's just not being published.
See, my problem is I have difficulty understanding English. Mm-hmm. So for me, you're going to have to interpret for me. Let's go to the phones.
We'll have to do a Mandarin course.
Mandarin, after 18 days in China 2 years ago, coming up this spring, I actually understand a few words in Mandarin.
Okay.
Bernice, thank you for calling. My fan club from Arizona. Thank you.
Yeah, good morning. Is there any cure or treatment for dystonia? And is there a definite test that tells that somebody really has that, or could it be something else?
Well, is it, first of all, child or adult?
Adult. She's about 65, maybe.
Okay. First of all, dystonia for our audience is involuntary movement contraction of muscle bundles in the body, and sometimes they're just very quick, very spasmodic, but they're of the slow, repetitive movement. So you go to do something and you see the muscles start to fire. The movements can be extremely painful, and people who have dystonia also may have a tremor or some other type of neurological aberrations as are associated with it. Muscle groups, throughout the body, none of them are exempt from this, and they continue to fire uncontrollably. It starts very quickly. Sometimes trauma will do it. Sometimes exposures to different chemistries. Inoculations have been known to trigger dystonic pattern. That's why I asked you whether it's an adult or a child. But having said that, there's something called torticollis. If you ever see somebody with their head locked to the side, that's can be called a cervical dystonia, also causes spasmodic torticollis, another interesting intermittent clonic-tonic spastic torticollis. What that means is the neck keeps moving intermittently but spastically, and there's no control over it. It'll tilt to one side. Sometimes the shoulders are pulled up, and it can happen, unfortunately, in that situation at any age. Somebody who has a torticollis or a locking of the neck, it's about 10% of the people have that type of situation. So going back to that, it can come from bad dental work. Somebody has a cavity or has a filling or has an implant or whatever done, and the dimensional height, the vertical height of the jaw, your hinge of your jaw is called the temporomandibular joint, TMJ. If that's not sitting properly, then what happens is that can cause a brain pattern aberration. It's like static on your computer screen, and then subsequently the muscles somewhere in the body are going to misfire. So we see it often with other types of demyelinating conditions like Parkinson's, the spastic gait of a Parkinson's patient. Sometimes you get the cramping with somebody who's a piano player, a musician. They can suffer the consequences of that. So is there one particular situation? No. There's some authors that I'll say that there's a genetic pattern. There's an aberration of a gene. The gene, if I can remember, it's something D whatever. I think it ends with a 6. D something T, it's coming back. I'd have to think about it for a few minutes. But anyway, there's several of these guys out there. They're just different mutants of the system. So is there treatment? We see a lot of patients in our practice with dystonic patterns, and we treat them based on what we can find the cause. Can we help? Yes. Can it be helped? Yes. Out in Arizona, you have some very phenomenal practitioners out there that may be able to do this, people who are versed in not only Chinese medicine, but in craniosacral patterns, manipulative skills, or preferably doing all those things at one time. So, Bernice, it's probably a topic I could sit here. We could talk the rest of the show on. DrTomRoselle.com, DrTomRoselle.com. Send me a note, and I'll go back with you again on this.
Okay.
And I'll try to give you some more direction. Thanks a lot, and I appreciate you guys listening.
Can I ask what a pregnant woman can take that?
We'll be right, Bernice, I got to take a break. We'll be right back after this brief interchange. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio on this absolutely stunning, gorgeous day. You're going to go downtown. You're going to look at the cherry blossoms after you listen to us because we're more important right now. We have more information that's going to be useful. The cherry blossoms are going to be for a moment. You can take a picture and carry it for whatever, but you're going to be listening to Dr. Stephanie Pina, who's my guest in studio, who is your host and presenter this Wednesday evening at the Roselle Center for Healing, 7:30 p.m., the 16th of the month of April. Oh, my God, it's halfway through. Did you get your Christmas shopping done yet for the end of the year yet?
I'm working on it.
Good girl. Good girl. This is going by so fast. It's like, oh, my God. You know, years ago, Dr. Stephanie, I used to listen to folks, you know, that had several decades on them, and they used to say, don't wish your time away. It goes fast enough as it is. When I first went in practice, 6 months was forever, and now 6 months I freak out, you know, no matter what the project is.
Yeah, I think I'm still in that mix of it feels like forever, and I don't know, it depends on the day.
You know, speaking of dates, you know, if I don't do this, a lot of people are going to be angry with me. Save the date, everyone. October the 18th, 2014, coming up this fall. What's that? That's our annual Ageless Health Seminar, a full day. Roselle Center for Healing, Caring for Others presents a day that you can't put all this information into one place for yourself. But I'll tell you what, it's Ageless Health this year, 2014. Tools to empower your health and change that of your families. I promise you, that'll be a day that you'll never forget. People have said it's like the amount of information you get is like drinking from a fire hose. It's over the top. And we're going to have a great time. I'll tell you more about it. Within the next couple of weeks, you're going to have the ability to register early and save a whole bunch of money. And it's cheap as it is. I mean, it's like we're going to give it to you. It's going to include your lunch and organic lunch and everything else. October the 18th. Put it on your calendar and register early this year. It's going to be a phenomenal blockbuster event. Let's get back to what we're talking about. Dr. Pina and I are talking about herbs, and she's going to present this Wednesday evening, 16th, at the office. Love to have you as our guest. All you got to do is call us at 703-698-7117. Let's go to the phones. Tom, thank you for calling. What can we help you with?
You're very kind to take my call, Doc. I normally listen to you when I'm driving back from church here in Northern Virginia. Let's call it that. I had deep vein thrombosis in 2011, 2012. It was because I smoked. I stopped smoking. I'm guilty of that, but I've been doing very well and off the smoke for quite a long time. I lost my job last April, about the same time I turned 65, and I've been jobless ever since. And I can't get my health care restored. That's not my question.
Okay.
My health care will come back. They'd say the Medicaid people say. In a few months, but I need to see a doctor, and I can't afford it because I'm jobless.
Okay.
I feel some pain in my leg that ranges from not so much there to very severe that makes me hobble. Like I said, I just came back from church, listening to the broadcast, and I barely made it back to my car because my left leg is so screwed up. And I know, having gone through this once, I know what it is.
Yeah, and you're in trouble. So let's let Dr. Pina and I talk, because I'm going to take it to an herbal place. And for our listeners, deep vein thrombosis, or as they like to put initials to everything now, it's called DVT. It's a thrombus. It's a blood clot, and it's in the vein, and usually in the lower legs. It can happen other places. You don't want it to go to your brain, because then you're gonna stroke out, or your heart. Same thing. Clots, can form superficial plaques, if you will, and plugs. And so subsequently you end up with inflammation, you end up with swelling, you end up with vascular changes, your skin can break down. It can, not only look ugly, but it also often can be life-threatening simply because of what we just said. It can release and go places it's not supposed to go.
At any point.
So, Dr. Pina, let's talk about this from an herbal point of view, because and I know there's stuff out there that can be useful and cooperative to traditional medical care that can help him. And first of all,
let me interject, if I could, Doc, before Dr. Pina chimes in. I was put on a very heavy vitamin B complex regimen, and that was like the ramping down after getting the bloodletting, and thinning out the red blood cells. And I was fine until January, when the stress of being jobless and the lack of funds coming in, I think that may have triggered it. I don't know.
Well, Tom, that goes back to our friend. That's a sympathetic reaction. That goes back to our friend, the adrenal glands, and it's a fight-flight reaction. Your adrenal system puts out steroids, anti-inflammatories, and if that system's not working the way it's supposed to, you can't put those out at the levels that you need to protect yourself. Vitamin B12, particularly either the hydroxy form of B12 or methyl form of B12, decreases the inflammatory reactions within the blood vessels themselves. But we could sit here and diagnose the whole thing, but I can't spend the rest of the program on it. So, but that's it. But I'll tell you what I will do, Tom. Send me a note at Dr. Tom Roselle, DrTomRoselle.com. I'll get to it at some point and give you some very specific things. But Dr. Pina, let's talk about this. Tom, just dietarily, there's a lot of changes you have to make. One of them is your diet's got to go way alkaline. You got to get a ton of vegetables, lean proteins, and get rid of the rest of the junk in your diet, including sugars and everything else. Now, we're going to put that aside because we can talk about that all day long too. But Dr. Pina, go ahead.
Well, there's a lot of different herbs that are what they call blood movers, or sometimes you even hear them called blood cleansers, that essentially can work on the cardiovascular part of it, so the actual veins stuff too. But the idea is, as you brought up too, a lot of this got brought on because of the stress. So this is kind of one of those things that's a multi-approach. You have to work on things that are going to work on stress, whether that's using stuff that's going to be, relaxing, working on diet, decrease basically the adrenals kind of fight-flight reaction. But then when you're working on the actual blood, one of the main herbs that you hear a lot about that people end up putting into their diet and stuff is horse chestnut. That works on the smaller blood vessels. It kind of opens up and dilates them as well. There's a herbal tea that's out there on the market that has some Chinese herbs, and I can't think of the name of it right now. But what it is it's got some salvia in it that essentially that helps stimulate blood flow and decrease clotting as well too. So there's a lot of different things that you can do to.
Salvia is S-A-L-V-I-A, salvia.
S-A-L-V-I-A. Thank you. Okay.
But just like with any of those herbs too, you want to make sure you at some point you're getting looked at too, because you want to make sure that they're not interacting with any drugs or medications that you're having, because that's one of the main risks that people run into when they find herbal side effects, is that has to deal with basically liver function, kidney function, and also making sure that they're not having problems with bleeding issues as well too.
Tom, listen, we're going to have to continue on, but there's a lot. It's just about opening the blood vessels. Hawthorn berry extract, although it's kind of straight up for the heart, is one that will also strengthen and open up the blood vessels. Cayenne pepper, cayenne in small amounts can be taken over a long period of time, and also vasodilates. It opens up the small vessels, the capillaries. There's things called niacinamide and niacin. They work cooperatively as well to open up the small vessels and the medium-sized vessels called the arterioles. So there's lots of things you can do, but it also comes back to starts with diet. You got to clean your system out. You got to get anything that's inflammatory out of the system. You'll find just doing that and dramatically increasing your water intake but it has to be good filtered water. Do not use distilled water in this particular situation. So I think we've touched a whole lot of stuff. Dr. Pina, there's a caller that doesn't want to go on the air, but she called in and asked about allergies for pregnant women. How do you deal with the springtime stuff with somebody who's pregnant? Because, you don't want to do drugs, definitely, because it's going to affect the child. Anything that you give the mother is going to affect the child. How do you deal with this and not jeopardize that fetus, that child?
Well, it's an interesting question, too, because even if you're just working with the pregnant mother, you have to, or if they have the child and they're breastfeeding, you get a lot of questions on which herbs are safe, which herbs are going to be passed through the breast milk to the child, which ones you have to be careful of. Even some foods, just in general, mothers who are breastfeeding will notice that their child will get more colicky, especially with the spicy stuff. But with allergies, what's interesting is a lot of the time I'll have women come in and I'll actually do more acupuncture with them because it's more safe and effective, and then you don't have to worry about a drug-herb interaction. You don't have to worry about whether or not it's going to have issues with the child. A lot of the more milder things like stinging nettles can be used pretty diluted out, and that will kind of help. That helps block some of the histamines. You can actually use things like some of the quercetins, which you can find in citrus, vegetables, fruits. You can use those as part of your diet. That's going to help out with the pregnancy as well. But a lot of times I'll use acupuncture on these because it's just a better and easier method for them. You can open up those nasal passages. And what's interesting in Chinese medicine is babies are kind of seen as little balls of phlegm, which essentially
that's true.
It sounds weird, but essentially allergies
little
can
mucus
be
secretion.
Yeah, exactly. Allergies are mucus secretions, so they're little mucus secretions. So you even have to be careful on which acupuncture points you use too, because you don't want to necessarily drain the phlegm. So the same thing can happen with herbs. So it doesn't matter if you're addressing allergies or any other conditions that pregnant women are going through. You have to know what you're doing if you're going to use herbs, whether that's over the counter or not, because there's certain ones that will create uterine contractions that are beneficial at the very end of a pregnancy, but not during the middle of the pregnancy as well too.
Pennyroyal, which is called the thinking herb, is also an abortive, so you have to be very careful. A lot of over the years they'll put pennyroyal in small amounts with other herbs to open up the lungs and open up the sinus cavities and so forth. But if you go to the store and you see anything that has pennyroyal in it and you're pregnant, stay away from it. Tansy's the same thing. Tansy's specifically an abortive, but every once in a while I see it in things that it shouldn't be in. And for the most part, you want to stay away from anything that looks like those two substances. And there's other in combination. Acupuncture, obviously, I know the points that you're talking about, we're not even going to suggest or tell people where they are because people get curious. So we're not going to...
no at-home acupuncture.
No home acupuncture or even pressure on some of these points sometimes. So you want to leave them alone. There's so much that can be done. One of my favorite herbs, this time of the year, if you did nothing more, then start dosing very high with vitamin C, which is not going to hurt anybody. It's going to tone arteries. It's going to increase immune response, upregulate the adrenal system. It's going to have a profound effect on histamine reactions or antihistamine reactions in the body. And, we're talking 2 to 4 to 5 to 6,000 milligrams a day. The side effect of vitamin C is intestinal cramping, loose stool. But if you don't get to that, you can take it. And if you do get to that place, you just back it off a little bit. One of my favorite herbs that I like to use when nothing else seems to work or a patient won't stay on something are old-fashioned things like echinacea. And so let's address that relative to this woman. Is echinacea a problem for somebody who's pregnant?
In low doses, not necessarily. You certainly wouldn't want to do a really high dose of it, just like with any herb. There's a number of different types out there. There's Echinacea purpura, there's an Echinacea angustifolia. Certain ones are going to be more present in kind of the over-the-counter herbs or herbal supplements. You're going to see more angustifolia because it's a little bit cheaper to grow, we'll say. But it can be used short periods. I find it best when people use it on short periods versus sometimes even when it's not a pregnant woman, that basically they'll use it as a preventative for a longer period of time. I like to use it hardcore when you need it and then leave it alone because your body responds a little bit better. But echinacea is one that also kind of gets a little bit of this bad rap out there because there is some scientific research that it says as it's stimulating the immune system, it may be overstimulating. So with autoimmune patients, you have to be a little bit careful. But again, if you're using it as needed, you're not going to run into having doses in the body where that happens.
You know, going back to German studies, that's where a lot of this came. And this goes back decades ago when that first came out. And what they said is that echinacea does not have a compounded effect over a period of time. It hits a certain level, and then that's it. So giving more of it after that is not reasonable. Well, the truth of it is that once you hit that level of immune response that you want with echinacea, giving it perhaps at a lower dosage or for an extended period of time for some people whose immune systems are crashed is appropriate. It actually is continuing to work. The only thing that you have to worry about, and here's the toss-up question I would like to deal with for a couple minutes, is simply this. Herbs, even though they don't have the side effects, they are foods. They are natural remedies. And like any drug, any food, any substance, taken too long can develop its own allergic response in the body.
Yeah, absolutely. I mean, we see this where patients come in and they've been on the same, whether it be herb or even supplement, sometimes for forever, or you see it when for medication, people come in and they've been on Synthroid forever and they're going, is my body not responding? Herbs are just, if you're looking at them in a medicinal fashion, you have to treat them like medicine. You have to give them the respect that's deserved. While we have more availability to them now, and certain stores, are ready to give them to you in bulk herb and in tea form and in tincture form and even, in capsule form, you got to know what you're working with. That's when you have to work with someone who has studied this and understands what's going on, especially the more complex the case is. Because, like I said, there's ways of kind of approaching the body from multiple angles. And like in Chinese medicine, they don't do a lot of single herbs. And that's what a lot of people tend to go to the store and get, is just one herb. They hear this is the greatest and they go out and get it. In Chinese medicine, they'll actually combine multiple herbs, maybe 6, 10, I've seen 20 herbs in one formula.
At low dosages.
At low dosages, to basically that you take over multiple times during the day, and they balance each other out. So there's not one huge toxic amount of one particular herb. You have little ones, and those little ones that are in there may not be doing a whole lot, but what they do is they actually help out with the digestion of it. So they're working on that digestive tract that's just as part of the immune system as the main herb that's in there.
Now my patients understand why when they come in and they have whatever it is, and I just start prescribing herbs for them, that I usually give more than 2 or 3 at occasion. And I said, take a little bit of this, you put this, you put this, you put this, you're going to take it multiple times a day, is because the impact, the synergistic effect in combination is far more powerful than taking something one at a time. If you like what we're talking about, this Wednesday evening, the 16th of this month, 7:30 p.m. at the Roselle Center for Healing, Dr. Stephanie Pina will be your presenter, and she's going to get into the intimacies, teach you how to use this stuff, what to be aware from, because too many of you are going out there and you're going to the different natural food stores, and you're sometimes, in my opinion, I'm going to use the word, you're being duped. I mean, some of these things aren't what they say they are, some of them don't, and the thing is, you got to be careful today. Natural herbs, organic herbs are what you have to use. There's areas, and this goes the same thing for drugs. I mean, they're not clean, and you're getting the side effects of all this stuff. You have to be aware. She's going to make you aware. She's going to straighten you out and give you an application of step by step. So this Wednesday evening, 7:30 p.m., Roselle Center for Healing. We're right at the Beltway at Route 50 in Fairfax. We're in the Red Cross building. Love to have you as a guest. All you need to do to make that happen is call 703-698-7117. 703-698-7117. We'll be right back after some very important messages. Don't go away.
WMAL-FM Woodbridge, Washington. WMAL Washington, WRQX HD2, Washington.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live in studio, 888-630-9625. That's how you find us every Sunday, 12 noon. Same place on your dial. We're always here for one reason, to educate you, to give you more data than you can possibly think existed in the area of integrative and natural therapeutics. That's why we do what we do. We try to help you, empower you, to serve, to educate, and empower you to do your thing. That's our mission. That's what the Roselle Center for Healing is about. That's what this program is about. That's what all of our educational pieces are about. So at any time that we can be useful, you can get a hold of any of my staff members. Call our office at 703-698-7117. That's 703-698-7117. And that's the number that you register for this Wednesday evening's presentation to listen to Dr. Pina, our doctor of naturopathic medicine in office, tell you about herbal remedies that can help you in the spring, in the fall, in your life. You can ask her any question, regardless of what the condition is. This is our expert. She knows it. She knows it well. She's able to apply it very simply and easily in usable format that you didn't think was possible. I mean, it's not rocket science, as long as you don't have to pronounce the words. Because I can't pronounce the words sometimes.
We'll try to keep the Latin out of it, and we'll try to keep the Mandarin out of it for the Chinese herbs.
I mean, it would be a really good thing. I mean, I sat there. We had a conversation the other day, and as you know, I grew up with two languages and understood them equally until I was about 8 years old, 9 years old, and then my parents, because they wanted everybody to be American, stopped with the family language. But still, it's a struggle. It's like, try to get me to pronounce these things. It's a good thing I have a visual memory. I can see it, I can write it down, but don't ask me to pronounce it. It doesn't work. Not for my brain. So don't worry about it. You can come and you're going to learn a lot. I mean, she's going to give you things, and it's going to be on the screen, and she's going to talk to you, and you can ask her questions. And it's a great night. It's a good way to start out your spring, summer, and make it as powerful and as productive as you possibly can. Give us a call at 703-698-7117. Tell my staff you want to be there. Remember, we're in the Red Cross building in Fairfax, right on Route 50, less than about a third mile off the National Capital Beltway. Dr. Pina, tell us a little bit about the class.
Well, we're trying to make it an interactive one, so you may be tasting and testing some herbs and stuff as well, so you get to be a little bit more familiar with these. But we're going to break down what is herbal medicine, botanical medicine about, why is it as popular as it is right now, and what is the future for it? What is it used for in combinations? Are there pairs that work together that are that work well together? Are there certain illnesses and diseases that work better with herbal medicine versus other types of medicines? And how do you try to treat the body from a multiple step approach using different herbal products where they're combined together? How do you break those down and go, well, I took this, or I found this, interesting herbal formula. How do I know it's effective for what I need to go through? And just get to learn a little bit more about herbal medicine, especially since, things are out there, they're blooming, they're growing. We've got a great botanical medicine, botanical garden around here in DC. So if you're ever through there and you go, oh yeah, I remember hearing about that herb, you kind of have a vague idea of what that might be used for and why it's important to keep those plants and herbs growing too. How does it give back to the environment as well as help you?
I grew up with all this stuff in my backyard. My grandmother used to grow them, and garlic, and we use garlic all the time in our office, with different situations, and it has to be processed properly. If you get the stuff that has no odor to it, it doesn't work. And but there are profound herbal remedies out there. When we talk about stinging nettle, their work, it's one of the most profound applications for inflammatory reactions and also for allergen patterns. I mean, it's a great substance. It's something that we use. Onion de gato, cat's claw, great piece to use as well. Folks, there's a whole bunch of you sitting on the screens right now, and you got to remember, you got to call before we get to the end of the show, because I can't take your calls, and I want to take your calls because that's what we're here, is to educate you. But you can always get a hold of us at drtomroselle.com. But more importantly, come to this Wednesday evening's presentation, the 16th, at the Roselle Center for Healing. We'll be here next week, bringing you much more available information for your application. See you then. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.